Hello and welcome to another episode of our From the Helm series live here at Bell Potter's Healthcare Conference in Sorrento, Victoria for 2025. I'm Grady Wolf, Market Analyst with Bell Direct, and I'm thrilled to be joined now by John McCutcheon, the CEO and President of EBR Systems. Now, for those who don't know EBR Systems, it's a company aiming for outstanding treatment of cardiac rhythm disease through its innovative leadless therapy. Now, that's a bit of a mouthful there, John.
Yes,
tell us about what the therapy is and about the company as a whole for our investors who don't know.
Great. Thanks, Grady. Thanks for having me. So EBR Systems developed a leadless pacemaker for the left ventricle of the heart.
Wow.
And what makes it special is we have a very tiny implant. We say it's the size of a grain of rice.
So you can't even see it.
It's really tiny.
Yeah.
And that goes inside the heart in the left ventricle, and it actually paces the heart. We energize it remotely using ultrasound energy. So we don't need leads or wires that go into the heart. Pacemakers, the standard pacemakers have these leads or wires, and those are typically the biggest problem of these devices. They break, they migrate, they can get infected and cause a lot of problems. So we get around all that by having this leadless technology.
That is incredible because two of my friends actually have pacemakers, so that is amazing. Yeah. Now, can you please provide us with a brief recap of the results you've seen in clinical trials recently?
Right. So we did our pivotal trial. We announced the data in 2023, I believe May of 2023. That was published last year in the JAMA Cardiology, a very prestigious journal. And the results were really beyond our expectations. So there were two primary endpoints. One is efficacy, and the efficacy endpoint was to show that we reduce the volume of the heart. That may be counterintuitive, but if you think about the heart's function, you want to squeeze blood out. So they measure how much blood is left in the full squeeze. So if it's too distended, you're not getting it in circulation. So the endpoint is called, it's a mouthful, left ventricular end systolic volume.
I'm glad you're saying it, not me.
And all that means is when the heart squeezes, you don't want a lot of blood left behind. You want to squeeze it out. So we showed that we significantly reduce the amount of blood that's pooling and staying in the heart. Now that's the physiology, but what it means for the patient is they start feeling better. They actually are getting oxygen when they start walking and exercising. And these patients are really, really in bad shape. And they can't, we get anecdotes like they can't do their laundry. They can't go walk up and down the stairs. They can't do grocery shopping. And then they get the treatment and suddenly they're back to their old selves.
So can you outline the various uses and use cases of YCRT and the overall market size that EBR is aiming to address?
So our total available market in the US, we estimate to be about $3.6 billion US dollars. So very large market. That's about 80,000 patients a year at a selling point of $45,000. And that market consists of patients that have heart failure. Most of them will have a pacemaker in already. Pacemakers don't treat heart failure, they treat a slow heartbeat. And so often you'll pair them up and do what's called biventricular pacing, where we would upgrade those. We would add the left side pacer so that it beats in synchrony with the pacemaker on the right side. A good indication would be they've had an infection and they can't have a lead put in. They might have had a lead that was they tried to put in the left ventricle, but it broke or fractured. And so those are the patients that are really high need. They can't be treated any other way. We really are the last line for them, and it's life-saving, life-changing when they get it.
So it's a major new development really in this industry.
It is, and because of that, we were given the breakthrough device designation by FDA, which is basically a signal that there is no other choice for these patients.
And they need it. So talking about the FDA, once you do gain approval, what are the steps after that?
Well, commercialization.
Make money.
Make money and treat patients. And so we think that it'll be a successful business if we treat the patients well and they're doing well. So our focus will be on patient care. We expect to get FDA approval in the next probably a month to 60 days. So it's imminent.
Very close.
We're actually putting together our sales team, our early sales team. We'll do a limited market release. The way medtech works is if you go out and kind of shotgun it and go too fast, you can make mistakes. You want to learn things early, do it in a controlled way. And then once you feel like you've really got the formula, you start scaling that and adding salespeople and then driving significant revenue. So this year will be a limited market release. making sure that we've got all the formula there before we really hit the gas and push it.
So paving the way for the growth potential.
Exactly.
Now, how do you convince patients to take on this project and the product?
Yeah. Well, it doesn't take much convincing.
Yeah.
So they're without options.
Yeah.
And so both the patients and the physicians are looking for us often. And I think in the early days, we won't be even selling or convincing anybody. It'll be physicians coming to us that know about us or that we know them already.
Fantastic.
And they say, we've got a patient that there's no other option. We need this technology. And eventually then you want to go to the masses, but early on it'll be not a big sale.
Now, what does pricing and reimbursements look like for WISE CRT when you hit the commercial launch?
Yeah, so this is all US centric, what I'll talk about.
Yep.
So we believe we'll be getting a $45,000 per procedure.
Wow.
It's a lot of money.
It is a lot of money.
Yeah, it's like a small automobile, right?
Yeah.
Like, or maybe not a small one.
Maybe
like
two cars.
Yeah, exactly.
Yeah.
A nice automobile. So we'll charge that, and the reimbursement is there because we have that breakthrough status that I mentioned from FDA. That gives us the ability to apply for preferential reimbursement. So the way the math works is, and that won't be immediately available. That'll be available as of October 1.
Okay.
Because it comes from Medicare or CMS, and that's their fiscal calendar. So that'll kick in October 1.
Yep.
And at that point, we'll be able to charge, and then the hospitals won't lose money. They'll be able to get that covered by Medicare.
Yeah, so as we know, funding is a big gap in many of these companies, so it's really good that you have that in place before commercialization,
Exactly,
right?
yeah.
Yeah, so what steps are going into making and manufacturing the device before you do hit commercialization?
So we're manufacturing devices now. We have a small facility in Silicon Valley in Sunnyvale.
Yeah.
And we've actually signed a new lease, and we'll move into the new building in about a year. So we'll triple the size of our footprint. So right now we've got enough capacity to launch and probably go for at least a year or two, but we're investing ahead of that. We don't want to wait too late.
No, you don't need a backlog.
Yeah, exactly. And so we have a lease on a 50,000 square foot facility not too far from our current plant. We'll move everybody there eventually. And that gives us more capacity, but also gives us more capabilities to bring some more manufacturing processes in-house. That eventually is a play to drive down cost of goods.
And so finally, what will the go-to-market launch look like, and what steps are you taking to get the product to market?
Yeah, well, we're hiring people right now.
On the ground?
In fact, yeah, if you look at our LinkedIn, you'll see all kinds of hires in
jobs for
the sales
to go,
people.
Yeah,
and we've done a really good job of recruiting high caliber salespeople that have experience in our space. Yeah. It's a very complicated sale.
Yeah.
The physiology is really intense, and so you need people that kind of come from that background, have done it before. And so our chief commercial officer comes out of this space, has a lot of connections. So we bring those people in both for their technical expertise, but also their connections. They know the electrophysiologists who are our customers, and they know them on a first name basis and who to target and who are the likely early adopters. So we're putting those pieces together as we speak.
John, a huge 60 days and 12 months coming up for EBR Systems. We're so excited to follow your journey. Thank you so much for joining us today.
Thank you. It's a pleasure.
I hope you enjoyed that episode of From the Helm as much as I did filming it. If you did, be sure to subscribe to our YouTube channel.